So on the other side of the balance sheet when it comes to doctors is their expenses. And when it comes to their expenses, when you look at a doctor's office, approximately half of all the revenue that comes in goes out as far as costs. And so doctors have a large amount of costs. So in addition to having to pay things like employees, malpractice, materials, so forth, the physicians also need to pay for things like initial investment, student loans, and so forth. So here we have an example of a hypothetical physician's office and a breakdown of the practices. So here we had the gross revenue, $440,000, and when you look over here, you can see that the money that came in came from a variety of insurance, Medicare, Medicaid, and out-of-pocket. Now, half of all that revenue, roughly, was for net income or profits, but then the other half was for expenses. So we have things like non-physician employee wages. Those are going to be people like your nurses, your clerical, front desk, whatever it may be. Now, employee physicians, 3%. That can also be somebody who you may bring as a specialist, who maybe works for a hospital, somebody who doesn't have a stake in the practice, but they come in and contribute and see patients. There's also rent expenses, medical supply, and malpractice liability, and others. Now, when it comes to the doctor, the net income that we just discussed and have discussed, that median of $225,000, the average as of 2017 was up to almost $300,000. Okay? That's all we call accounting profit. It doesn't factor in the full opportunity cost, the full implicit cost, which we talk about in economics with the economic profit. And so in that pay, we don't count things like salary that they could have been making had they been doing something else. And we don't count the years that the doctors were in school and in residency program where they were making zero money or very low amount of money. So the other thing that doesn't factor in is the hours. On average, physicians work a greater number of hours than non-physicians. And so what they're doing then is they're giving up their non-labor time or their leisure time in order to work more. Now, the reason for that is that they, quite simply, it's expensive for them not to. And so every hour you spend in leisure or not working, you're giving up money that you could have been making doing that. And because they're able to charge just a high hourly rate by not working, they're giving up a decent amount of money. Now, a couple of other things with expenses. There are times when doctors will work at a hospital as opposed to running their own practice. When they do that, they get to use the resources at the hospital, the materials, the staff, and so forth, and they don't have to pay it. So it's just a way for them to kind of be a doctor, get paid, taking kind of the risk out of it as far as the standpoint of expenses. Malpractice. Malpractice is very, very important. So malpractice is insurance for doctors in the event that they get sued for from a patient for medical reasons. So a couple numbers. About 1 in 20 doctors will have a malpractice insurance claim filed against them in a given year. So 5% of all doctors, on average, every year get sued. Over their entire career, 2 out of 5, or 40% of all doctors, get sued. And that's why malpractice insurance is important. Because if you think about it, if you're thinking about becoming a doctor and you knew that there's a 40% chance of you getting sued, if you weren't covered and patients sued you, come after your house, your assets, your practice, whatever, not many people would do it. That's a very, very tough burden to bear. And so malpractice insurance is what allows these doctors to do this without having to worry about getting sued over doctor or patient gets sick or something goes wrong. Now, premiums for malpractice are also high. And they're high because when we talk about insurance, we say that the more the insurance company pays out, the more they need to collect. And so because doctors have lawsuits filed against them so often, well, the insurance company has to pay out a lot, so they have to collect a lot. The premiums also are going to vary by risk and specialty, because a cardiologist is likely going to be have a better chance of getting sued, because with cardiology patients there are a lot of risk. There's a lot of risk involved, and more likely to get sick or die. And so when that happens, it makes it more likely to get sued. Whereas a pediatrician, on the other hand, it may not be as likely. Okay. So the premiums really vary depending on how likely it is that the doctor have a lawsuit brought against them. But in general, this is the breakdown. Right? They get the revenue coming in, but a lot of that has to go towards their expenses.